Life in South Africa has its ups and downs. There are about 63 million people living in our country, and in their lifetime, the average person will face different life challenges, such as fragile family dynamics, overcrowding at school, teenage pregnancies, gender-based violence, divorce, crime, work stress, trauma and illness. 1 out of 4 of these people will experience a serious mental health crisis and need help. Only 1 out of 10 of these people will get the appropriate treatment.
Chief Executive Officer Dr. Ingrid Daniels reflects on Cape Mental Health's role in reaching the people that have fallen through the treatment gap.
We know that only 5% on average of the health budget is spent on mental health. And when you break that down, 86% of that allocation is spent on inpatient care and infrastructure. People live in their communities and should be supported in their communities. We found from a national survey done by Docrat and others that only 14% of the mental health budget is spent on primary health care and some community interventions and obviously medication. So our journey of bridging the gap started 111 years ago. We started the organization in 1913 because there was a huge need to support women with intellectual disabilities who were being abused on the streets of Cape Town. So the organization in the early 80s started for the first time special education and care programs for children with severe and profound intellectual disabilities living in very dire communities within the Cape Peninsula area. We've also known for starting what we call training workshops unlimited, because we believe that young people with an intellectual disability have the right to have their skills developed and to be placed in work areas that are suited to their functional abilities. We've also started, for the first time, a mental health school-based intervention program called Youth Matters. The organization has also started an easy-to-read program, the first of its kind in South Africa, where we translate information into accessible information for persons with intellectual disability or those with reading challenges or literacy concerns. The other intervention that we do have are our psychosocial rehabilitation interventions, and we're one of 350 clubhouses across the world providing recovery-orientated mental health support programs. And we keep people out of hospital. So Cape Mental Health has a very good partnership with state departments that have been funding us over many years. However, over the past decade, we have seen a consistent decrease in funding support. As recent as last year, 26 psychosocial rehabilitation groups, which kept people out of hospital and received funding for many years, were found in a situation where funding was ceased. And sadly, those groups had to be stopped because there was no money.
Social work manager Wasima Fisher oversees a team of social workers who go out on a daily basis to work with people with a mental diagnosis. The shrinking health budget impacts their work directly.
Cape Mental Health provides a range of services in the community by way of social work services, where they do field work visits. In addition to that, Cape Mental Health also provides training and awareness programs in the community to raise awareness about mental health. And we also provide training of social workers in the rural areas. So currently our social workers are only limited to our metropole area. Technically we are supposed to be able to go across the Western Cape, which we do not have the resources to do that. Should we have more resources, obviously that kind of service would be able to be rolled out so that we can reach other people in the Western Cape also with social work services.
Community-based mental health care services are low on the government and policymakers' list of priorities. We spoke to Professor Johannes John Langbar from the School of Applied Human Science at the University of KwaZulu-Natal about the impact of inadequate mental health care services in South Africa. Professor Langbar serves as the Vice President of Cape Mental Health and is an advocate of community-based mental health care.
As you know, mental health remains a neglected priority. It's low on the agenda of policymakers and funders at both the national and international levels. The challenge of underfunding is that the biomedical model remains fully ingrained in mental health care service provision, and that approach is not helping the situation. It denies optimum quality of life in the community and unnecessary pathologization of the human experience to treatment and recovery, and the long-term effects are not too good for South Africa and the rest of Africa. Obviously, it impacts on the most vulnerable among us, such as those living with comorbidities, such as disabilities, including individuals with intellectual and developmental disabilities, the poor, and people living in rural areas. It impacts them, more than us living in urban areas, especially in Africa. The impact on the recovery journey to treatment may be entirely out of reach for folks like that. People, the poor, that can't access mental health services because they just can't afford it. In most parts of Africa, there are very few mental health professionals. In some countries there is only one psychiatrist to 100,000 people. There is hard evidence that community-based mental health care is most effective and cost-effective, and that the impact on financial resources for care reduces significantly as hospital visits reduces significantly. There is without a question strong evidence on the utility of community-based oriented mental health care provision, to the extent that these approaches align with human rights principles and therefore often incorporate peer support. Because there is substantial benefit in engaging with peers with similar experiences in developing communities that allow for connection and support and in building self-efficacy rather than relying on the intervention of a psychiatrist or a clinician.
Peer support is one of the cornerstones of community-based mental health interventions. Cape Mental Health's psychosocial rehabilitation program employs persons with a lived experience to support others who are starting their mental health recovery journey.
Hi there, my name is Dylan Rademeier and I am a peer supporter here at Cape Mental Health. Peer support is basically providing counseling from one person with a lived experience to another. Peer support helps to bridge the gap between hospitalization and the reintegration into society by ensuring that the person understands the diagnosis, by ensuring that they are medication compliant, and by providing various coping skills throughout the journey. And peer supporters are there to walk the journey with the person.
The work of Cape Mental Health has been impacted by government's recent cutback in mental health spending. We asked Professor William Gumede, who is based in the School of Governance at the University of Witwatersrand, why this has happened and what needs to change. Gumede is a political analyst and the founder and executive chairperson of Democracy Works. Most recently, he was the independent chairperson of the negotiations to establish a multi-party charter for the 2024 South African national and provincial elections.
Why is mental health care not more of a priority in government?
I mean, the sad part of it, in national, when the national budget is put together, and even when provincial budgets are put together, normally what happens, mental health actually, gets among the lowest allocations. Why is that happening? I mean, the first thing is there's a poor understanding of the extent of our mental health crisis in South Africa. Secondly, often what happens is people have a view, and you can also see it in government, that mental health is only institutional. So funding becomes only institutional. So mental health is seen as isolated. And then the last one is also the stigma around mental health. There's a stigma, a cultural stigma, particularly in the Black communities, of mental health. And lastly, companies, businesses are often also don't take mental health serious. I mean, it'll be businesses will give a lot of money for other health, non-mental health, but not for mental health.
What can we do? What needs to change?
First, there has to be public understanding, wider understanding among the public. There is lack of understanding that mental health impact on the economy as almost the same as physical ill health impact on the economy. The same with the media also. We need to put mental health on the agenda and why it is important. And secondly, as part of putting it on the agenda, we also have to destigmatize mental health. And then I think we have to target government, but we also have to target business. Companies have a responsibility not only to provide mental health benefits for their employees, but also in their corporate social responsibility, in their philanthropy, to give to mental health as they would give, for example, to sports. Or for other kinds of activities. The very first thing is that mental health organizations will have to come together as a group, as a sector. And as a sector, actually petition governments on how, what should be the funding and where should the funding be going. So it's not just getting more money, but it is the distribution of that money. So it's not just that money goes to institutions, but that money also goes to rehabilitation. I think mental health organizations should actually come together and actually put a plan together for the next 5 years. That is very important.
The one thing all South Africans have in common is our innate ability to survive. The trainees at Cape Mental Health Training Workshops Unlimited and the service users at our psychosocial rehabilitation program have overcome many challenges. Their resilience in tough times echo in their messages of motivation to their teammates.
My motivation is I was almost in gangsterism, and coming here by the work was a big change for me. And my work here is be a team leader and stuff like that, helping others.
My name is Tommy. I get advice to my mom to be open with people in that workshop. They help me to be open with people, and the advisors help me to be open with people.
If you are struggling with your mental health at the moment, I would like to invite you to attend one of Fountain House's programs, as it helped me to not feel so isolated, and it was wonderful to join a community that understands what I'm going through.
The next 5 years is critical to Cape Mental Health as they navigate their way through the challenges facing the mental health sector. We are able, as our teams combine strength, skills and resilience, have prepared the organization to face any future trials with confidence.
And so Cape Mental Health has put together a strategy that will hopefully see an increase in our income from diverse income streams to supplement the huge gap in funding. We need support, and we need people to come alongside us and support us to provide the services in these communities where large treatment gaps exist. Everyone has the right to receive mental health interventions in their communities. There's a beautiful quote by Elsie Lincoln Benedict, who says, "If you keep thinking of the gap, instead of the bridge, you'll never bridge the gap. And for Cape Mental Health, when we see the gap in treatment and access to interventions, it's our calling to ensure that we bridge the gap and make mental health a reality